You were in the minority in the room, 33 Republican governors, 1 independent, 16 Democrats. We just heard from almost 3 Republicans that made it sound like all of the governors were speaking with the president in one voice. Is that how it was in the room?
No, quite frankly, there are Republican governors who have expanded Medicaid and done so very successfully. I want to make a very important point, if I can. What they're saying is on the exchange, policies are too expensive in some places, and I understand their point there, but they then use that as an excuse to try to take Medicaid away from millions of people. Those two things are unrelated, and for anyone to relate those in this discussion, quite frankly, is that they're simply looking for cover. The reason insurance is expensive on the exchange is that health care itself is expensive, and that the modeling that was done was faulty. That we can repair. That's fixable. Medicaid has been a game changer for millions of people who are now getting care who never got care before. I heard the governor of Kentucky. Quite frankly, you need to have a better delivery service. The idea that the way to make health care affordable is to make people not be able to have health care doesn't make a lot of sense. What you end up doing is a lot of people in emergency rooms at hospitals and hospitals not getting reimbursed, and that'll put your few remaining rural hospitals out of business.
Well, did you or other Democrats get a chance to speak your mind in that room to the president?
There was some exchange. Quite frankly, on this point, I think it was somewhat muted in the sense the president spoke to us and he had a point of view. Secretary Price got up and handled a couple of questions on the subject matter. Clearly, what they're trying to do is to use the exchange issue as cover to do away with Medicaid or take Medicaid down from where it is currently available at 138% of the poverty rate down to 100%. Therefore, throwing millions of people off. That's going to have job implications. It's going to have hospital existence implications. And, of course, we're going to lose lives as a result.
Well, Governor,
so there are very different views. Now, but no, let me say one thing. You asked earlier about where are all the governors. The Republican governors are not lockstep on this. Republican governors understand that their citizens are healthier today as a result of that Medicaid expansion. So let's be very clear. When John Kasich says that he's not supportive, he's not supportive. I was sitting next to governors from Republican states that have expanded Medicaid, and they're quite worried about the implications.
So that was going to be my next point, Governor. Among the governors in the chatter, you know, I presume you didn't just meet for this meeting, you've been meeting all weekend. What is the consensus about what the likely outcome will be? We've heard so many different views from the White House now, and it looks like we may even be getting a rollback of some of what the White House originally wanted.
Right. Well, that's hard to tell, quite frankly, because even in today's sessions, as various people spoke about the same issue, you got different points of view within the administration. So they're not all on the same wavelength. What the president said is he was hoping to have this out by the end of March. And then he told the secretary, well, maybe he should do it in 3 weeks instead of 4. I get that this is a work in progress, but on this fundamental issue of who's going to be responsible for throwing millions of people out of a health care system, quite clearly the Republicans want to own that, and they should own that if that's what they're going to do. But you asked what do I predict happens? I think the House will take this up. They'll debate it for a period of time. Maybe they'll get a vote on it. Maybe they won't get a vote on it. Whatever the House passes, the Senate won't pass. That's my prediction.